Marfan syndrome. It is an autosomal dominant connective tissue disorder due to abnormal fibrillin glycoprotein caused due to mutations in the FBN1 gene on chromosome 15, which codes for fibrillin 1, and it affects bones, joints, heart, eyes. A classic appearance with Marfan syndrome is that they are tall with long extremities. Another classic finding is chest wall deformity, pectus carinatum, pigeon chest, or pectus excavatum. The extremities of Marfan syndrome patients are hypermobile joints. They tend to have long fingers and toes, often said to have arachnodactyly, which means a long, curved finger, like a spider leg. There are two classic signs. First is the wrist sign. Tip of thumb covers entire fingernail of the fifth finger. Second is the thumb sign. Thumb protrudes beyond the ulnar border. There are a couple of eye findings in Marfan syndrome. Cataracts at an early age that is pre-senile. In addition, they can develop dislocation of the lens. Commonly occurs due to trauma. Sometimes can be associated with a systemic condition. The most common systemic condition that is associated with the dislocation of the lens is Marfan syndrome. Classically, the type of dislocation in Marfan syndrome is the lens dislocated upward and outward. And finally, there are a couple of cardiovascular manifestations of Marfan syndrome. They can develop mitral valve prolapse. The most dangerous complication of Marfan syndrome is that they can develop thoracic aortic aneurysms and dissection because the aorta has elastin and fibrillin. They can develop cystic medial necrosis, which means the presence of cysts and necrosis in the medial layer of aorta. And the last topic is about Marfanoid habitus. Here, patient looks like they have Marfan syndrome. So they are tall with a long wingspan, long fingers. And this is seen in some rare systemic diseases like homocystinuria, multiple endocrine neoplasia type 2B, also seen in some rare forms of Ehlers-Danlos syndrome. Don't forget to subscribe for more.